everyone, and welcome to this special episode of What Africans Want. My name is Muloongo Muchelemba, and I am the founder of Ongolo.com, a Pan-African website whose main objective is to keep Africans connected and engaged and to promote Africa and Africans. On today's program, I'll be talking about Africa's response to COVID-19, and specifically how Africa blew an early lead to actually contain this virus, and yet today we're racing towards 1 million cases in Africa. So what went wrong? And I'll be going through some brief analysis of the different countries that have responded to this well, and what we can learn from other countries in the world, and where it went wrong and what we need to do to fix it. So I'm going to share some slides and I'll go off camera. Okay. So the title of my presentation today is Ongolo Conversations, COVID-19 Pandemic, How Africa Lost Control. When the COVID-19 pandemic started at the beginning of this year, Africa looked like it had escaped the worst, and we started celebrating our good fortune very early on. This assumption that Africa would do well was based on two things. The first was that Africa would escape the same way we escaped the other coronavirus back in 2003, 2004. Africa was not hard hit by SARS, but the world was a very different place back then, and not nearly as interconnected as it is today. The Telegraph newspaper reported that Chinese people made 10.5 foreign trips back in 2001. That number today has grown to 150 million foreign trips in 2018. So Chinese people are coming out of China very more often than they were back in the day of SARS. And that is something that we've seen was the main reason why the epidemic or the pandemic spread as quickly as it did around the world. And the second reason that Africans felt comforted by this virus was initial reports were that COVID-19 mainly impacted the old. And given that our population is mostly youthful, that gave us comfort that we would escape the worst of it. Now, most countries did the right thing as soon as the first case was confirmed in Egypt back in February. Lockdown was swiftly implemented and borders were shut, flights were canceled and airlines were down. And the numbers reported in the first few months were very encouraging and indicated that things were under control. But today, our numbers have risen very sharply, and we're racing very quickly to the 1 million cases mark. So let's look at the latest statistics to understand where we are today before we go into why we got here. So the table on the screen shows the top 10 countries in Africa. So as of yesterday, WTO reports that Africa has 770,000 confirmed cases. And of these cases, about 62% are actually in South Africa. So you see the number there of 482,000. And then the top 10 countries are Nigeria, Ghana, Algeria, Kenya, Cameroon, Ethiopia, Cote d'Ivoire, Madagascar, and Senegal. Now, what's interesting to note about these numbers is South Africa accounts for 63% of the cases in Africa. But South Africa has also tested 2.7 million people. Their daily average testing rates are between 20 and 30,000 tests per day. And they've had some days where they've tested as many as 57,000 people. Now, bear in mind, South Africa has a population of less than 60 million people. I think their number is actually, 60 million people. Whereas Nigeria, which has a population of over 200 million people, has tested less than 140,000 people in total. When you look at the data that's available on their testing rates, they're doing anywhere from 1 to 4,000 per day, though they did have a high of about 8,000 cases. Senegal, jumping to the bottom, is an interesting one because there was a lot of news about how they developed a test that costs $1 per day. And yet their testing rate is not that high. They're testing on average 1,500 people per day, but they do have a small population of 15 million people. If you look at some of the big numbers, so Ghana was another country that started off strong in managing COVID-19. They're testing between 5,000 and 7,000 cases per day, though that number has dropped quite considerably in the month of July to 3 to 4,000, but it's still much higher than other countries. And then Kenya is testing 4 to 5,000 per day in a country of 52 million, which is comparable to South Africa. So you can see that the gap in the countries are wide. And so if you're sitting there thinking 770,000 cases is only 5% of the global total, to be honest, I think it's a case of we're not testing enough and therefore we're not finding, like South Africa. So if you look at South Africa with its higher GDP per capita, slightly more social protection than most African countries, much better healthcare facilities than most African countries, and they are finding 482,000 cases, having tested nearly 3 million people. I guarantee you, if the testing rate was the same in other African countries, South Africa probably isn't the number one country in Africa. So it's something to think about. And then you might be sitting there and asking yourself, why does testing matter and why is it so important? Because that's the only way we can catch people who have the virus and stop them from spreading it to other people. So I thought it would be a good idea to recap exactly why COVID-19 is spreading very quickly, and more importantly, why it's killing people a lot more than SARS did, and a lot more than everyone originally anticipated when this pandemic began. So what do we know about COVID-19? So I'm sure many of you have seen this before, but it's always good to just refresh our knowledge on what we think we know and understand the gaps. So the common symptoms are people have fever, which is why testing temperature everywhere you go is become the norm, because they're looking for people with temperatures of over 37 degrees, which is the normal temperature rate, human body temperature rate, and anything above 37.5 really triggers alarm bells. A dry, persistent cough is an important symptom because the virus irritates the lining of your lungs or your air passageway. So that's usually an indication that something's happening in that area. And people get fatigued a lot and heavy tiredness, cannot move, no reason why you should be exhausted. You might want to check if you've been in contact with anybody who has symptoms similar to this. And what we're finding increasingly is people are starting to feel a lot of aches and pains, and sore throat has become one of the increasingly common symptoms, as well as loss of taste or smell. Difficulty breathing is one of the more serious ones. So people who've been ignoring their symptoms, or like in Africa where we like to self-medicate, if you start having difficulty breathing, then chances are that the virus is at an advanced stage and you might have left it too late. And sometimes people have chest pains, which mimic what a heart attack would be. So what I was curious about when this virus first started is that in Singapore, where I live, the death rate has been really low. And that's probably because, and I'll explain in further slides, because the strain has been milder apparently than what we've seen in the US and Europe, but also because the government has taken quick steps to actually identify and prevent people from getting to a stage where the virus could kill. So initially, we all thought this was, coronavirus. So it was about having like a cold, like a really bad cold. But what has shocked me as I've been doing research for this presentation was that actually COVID-19 is a lot more serious than we all thought at the beginning. And on the right side of the screen, you'll see the points about how it kills. So we all know that a lot of people have caught pneumonia after suffering from COVID-19. And depending on your immune system and your age, this is a very dangerous disease to have. And that's what people had been treating at the beginning. But what's been happening since then is that things like the impact on the heart and blood vessels have become more apparent. So apparently, COVID-19 weakens the heart, and it also causes blood clots. So you've had people go to the hospitals who seem to have a heart attack, and the normal way to treat a heart attack or to identify a heart attack is to inject blood in the system to identify the blockage in the blood vessels, and they're finding no blockage. But then when they test people for COVID-19, some of those tests are coming back positive, which seems to indicate that COVID-19 is actually weakening the heart. So if you have heart problems, this is something to really take note of. And if you have a history of blood clots, you're even more at risk because this is causing blood clots. And actually some of the autopsies of people who seemingly died from pneumonia revealed that they actually had blood clots in their lungs. The other thing that's being observed is that COVID-19 is causing renal failure, especially with people who already had underlying illnesses. So one of the symptoms that was being looked at was the increase in the number of dialysis requests in hospitals, which also had high number of COVID-19 cases. The fourth thing that's become apparent is that COVID is also causing brain seizures. So again, people with underlying illnesses or epilepsy, for example, might want to take note of this. If indeed it is affecting the brain, then you might want to know that this is actually more serious than we thought. And then the last thing is digestive tract. So COVID is causing diarrhea. So for some countries actually list diarrhea as one of the symptoms to look out for. But for other people who may not have some of these underlying illnesses, will find that they could get a severe case of diarrhea. And as we know in the global south, diarrhea actually results in dehydration and could actually kill you. And I thought it was not a killer disease, but it actually is. So if you want to read more about this, I've put the source. It came from sciencemag.org, and the article is dated 17th April 2020. So rounding up what we've just discussed about how the virus kills you, it's important to look at the key risk factors. And the reason I flagged this is when I look at many of these, alarm bells start to ring, especially when I think of Africa. So when it comes to age, the group that's most at risk are the people who are over 65. So not only are the aged more likely to have underlying health conditions, but their immune system is not as strong as it was when they were a lot younger, which is why the elderly were always flagged as the most at risk, and we should keep that in mind. The second thing that's interesting is diabetes. So there's something about COVID-19 when coupled with diabetes that affects the body's immune system and its ability to regulate sugar. So what's been happening in some countries is that people with diabetes have, allergies. People with diabetes have found that their body is unable to compensate for their already underlying weakness when they have COVID-19. And given that diabetes is very prevalent in Africa, this is something that we really need to watch out for. So if you're diabetic and you tick more than one of these boxes for the things that are on the screen, you might want to be a bit more careful about how you interact with people during this time. So I already mentioned heart disease and how the viral infection weakens the heart. And the empirical evidence for this comes from Wuhan, where they found that 1 in 5 patients developed a weakened heart after COVID-19. So it's something to keep note of. The other reason I'm flagging this is hypertension. In Africa, we have a lot of people with high blood pressure. In my family, most people have high blood pressure. Most of my friends have high blood pressure, and people in Africa love salt, which is one of the things that keeps that blood pressure high. So we need to be mindful of that and probably make some adjustments, especially when it's lifestyle driven. Smoking is another thing that gives you a heightened risk of developing pneumonia, which we flagged earlier on. And research is finding that obesity is increasingly, people who are obese are finding it harder to fight the virus. Now, I don't know if that's because obese people tend to have, the diet is so poor that you're not eating right and they're not helping your body build up that immunity. It's something that's probably worth researching. But when you look at the people who have, especially in the US among African Americans, you had the race plus the overweight was causing a lot more deaths in that particular group. And then blood type is something that's been flagged. People with type A at the highest risk, while people with blood type O have the lowest risk of catching COVID-19. And then genetic factors, of course, are really important because this is the building blocks of your body. And if you already have a predisposition to coming down with diseases, you might want to monitor your risk in terms of catching COVID-19. So again, if you want to read more about this, the source of this analysis is Life Science, an article in July 2020. So let's go into the countries that actually managed the COVID pandemic well before we come back to Africa. Now, everyone's been talking about New Zealand and how their strategy was the best in the world. Now, you might argue that they're an island, so it's easier to control your body, your country when your borders are surrounded by water. Fair enough. But the truth is that New Zealand was very quick to act And they took the right steps to make sure that they were crushing the curve. So they weren't trying to, reduce the number of cases. They were trying to eliminate the cases because they just did not have the luxury of having the pandemic run rampant in their island. So how did they do this? They had a strong testing program where they tested everyone who they thought was at risk. And they had a strong contact tracing and isolation regime where they traced people who were in contact with people who had been tested positive and then kept them away from the population to limit the spread of the virus. They also had strict physical distancing in place, and they had measures to clinically manage all of the infected, which is important as well because you want to have a specialist center to actually treat people who are sick, because that's the only way you can contain the virus spreading. And then they also communicated quite often with the public and ensured that there was adherence to public health guidance, which is also really important because everyone looks to the government and says it's what the government does that determines success. But actually, it's how the government and the people work together, which is the last point, work together to actually protect themselves, their families, their neighbors, and their friends. So New Zealand was all about, we are a team of 5 million and everyone has a part to play. And I thought that was really powerful. And you saw the Prime Minister come on TV several times and really take accountability and ownership for the problem. It wasn't someone else's problem. It was coming from the top of the house. And I think leading from the front was one of the key things that led New Zealand to actually manage this pandemic well. The other country that led from the front is Singapore, where I am today. So Singapore, we've had regular communication from the Prime Minister and most of his cabinet along the way as this virus has been spreading. And just to give you some background, so we got the first people from Wuhan into Singapore around the 25th of January. About 9,000 people came into the country. And we were immediately notified that we had people in the country from the high risk or the epicenter of the virus, and that there were contact tracing and making sure that we were safe. So we immediately knew what was going on. And the government has been very good about publishing everyday statistics of the number of people who were sick, where they contracted the virus from, and then making sure that we all adhere to measures to keep the virus under control. So that's where the clear public communication comes in. There's no sugarcoating it. So when the Prime Minister came on, before we got out of circuit breaker, which is what we called lockdown, he was very clear that the pandemic had taken its toll, but we had to all play a part. And I thought that was really good. The other thing that they did actually to get us to adhere to the public health guidelines is we received assurances that all people who were infected and treated at public hospitals would be fully paid for, which when you're a foreigner living in Singapore, where a simple procedure will cost you $5,000, was really reassuring, and also meant that people were not afraid to be tested. So so you know, Singapore has tested, I think, over 1 million, over 1 million people, and has capacity to test about Singapore has tested 560,000 people, which works out to 177,000 people per million cases, which is a statistic they're using to compare countries, and has a capacity to test 40,000 people per day. So when you look at what South Africa is doing, it's actually comparable to first world countries. And so that's quite impressive for South Africa. So Singapore's strong testing is really important. I'm sorry, I missed one thing. So the careful easing of circuit breaker is important. So circuit breaker was our code for lockdown. And what Singapore did is they gradually eased the restrictions when certain metrics were met. So when they felt that the cases were not going to spiral out of control, they slowly, first in June, so the circuit breaker started April 2nd and ended sometime in mid-June. And they eased restrictions such as we could go out, we could meet people, but very small numbers. So we can't to this day meet more than 5 people. We couldn't have people at our house initially, but now we can. And they're increasing that to 10 people. It's currently 5. They'd open up, restaurants. In the beginning, it was you pick up your food, and now we can actually go and sit down. But there's still restrictions on gyms, for example. So my gym is operating at a quarter of or a fifth of the capacity. And when I look at at Apple Store, for example, the big Apple Store here in Singapore, I reckon they're not seeing more than 40 clients when they used to have more than 200 in the store at any one point in time, because I counted when I went there last week, which apparently they didn't want me to know how many people were in the store, but I did that anyway, just to show the impact of the virus on companies in Singapore. But the government's being really strict, because the more people are able to stand at a distance of 1 to 2 meters, the less likely they are to spread the virus. And that's been really commendable. And we're kept informed at every stage of the way. So I'll go with the last 3 points around strong testing. So Singapore is testing quite rigorously to identify people who are sick. But the thing that I give them the most credit for is contact tracing. So Singapore was able to identify every single person. I think they got to 98% of the people who were infected, and were able to identify the point at which they got infected. And just to give you some context, I mean, one of the big clusters that triggered the virus was a Bible study group that met, and the government was able to trace all the people who were at that Bible study group, and able to trace who they met subsequently in order to catch the virus before it spread further. But the story that really fascinated me was there was one couple from Wuhan who then spread the disease to other people, and the government could not figure out how they did that, because they did not go to that Bible study group. So they looked at CCTV footage of the church and found that a couple who contracted the virus early on sat in the same bench that a couple from Wuhan had sat on in an earlier service. So it might be that they touched the surface or whatnot, but they literally caught the virus by sitting in the same chair as 2 people from Wuhan who had attended an earlier service. I mean, that is the level of contact tracing. So if your government is not doing that, I'm sorry, that's not contact tracing. Like, if they can't figure out how people got it and do that investigation, then you're not contact tracing. And I will be amazed if any country is doing this as well in Africa. And the last point, which is a really important one and will become more apparent when we talk about why Africa got it wrong, is social protection. So Singapore has foreign exchange reserves of about 370 billion US dollars, and they have drawn down about 40 to 50 billion US dollars of that to support individuals who cannot work and give them some sort of social protection. They've also supported small companies to make sure that people, the owners, are able to continue paying, salaries, or to continue paying their bills, and to protect them from actually not closing down. So 40 to 50 billion dollars in reserves is more than what Nigeria has in reserves. And the reason why this is important is that the government has always been criticized for not sharing the reserves and always seemingly keeping that pot of money for God knows what. And they came out during COVID and said, this is why we have a rainy day fund. It allows us to be able to take care of our people when we really need it most. And why this is important, in Africa, we've been going to the IMF to beg for money to do just that. And negotiations, depending on which country you are, have been really protracted. So while Egypt was able to get money in May, my country, Zambia, is still begging, and we don't have any money to do any of the things that other countries have been able to do. So this is a really important point. And one might argue that Singapore and New Zealand are both very rich countries. So of course they were able to do this because they can afford to do it. So let me give a shout out to one African country that I think has done a really good job, and that's Mauritius. So you might argue that all 3 of these are islands, and yes, so be it. That means that they can control their borders properly. But what they have done to manage the pandemic can be adopted by other countries. So the first thing that Mauritius did when the pandemic started, was that they suspended flights to China and Hong Kong at the end of January, and I think Hong Kong was the 4th of February. Now, why is this important? Ethiopian Airlines, whom I love and always support, continued to fly to China, and Kenya Airways continued to fly to China for much longer than other airlines did. And I think that really contributed to bringing more people into Africa that had the virus. And I'm not putting the blame on them, but I'm just giving an example of how every little action actually contributes in this continent managing this pandemic and managing the next coronavirus pandemic that will hit the world. So we just need to be careful about this. So they suspended flights. They implemented quarantine for all visitors, including from Singapore, and everyone from Singapore, Malaysia, Thailand, and of course China had to be quarantined for 14 days when they landed in the country. And all of this started the first week of Feb. So they were taking the news from WHO and actually acting on it. And if you read about New Zealand, same thing. They got news from WHO, they got guidance from WHO. So while most people were distracted by the whole fight about Dr. Tedros and whether he was in China's pocket, countries like Mauritius and New Zealand were actually taking the learnings and saying, we're going to do something about our countries today. Another thing they did that was similar to Singapore and New Zealand is they had a comprehensive public education program. So most people assume that everyone knows about COVID, how it spreads, but you will be amazed how many people are ignoring basic guidelines like wearing a mask at all time and washing your hands, and also staying at home. So education is really important. So they also implemented legislation to ensure adherence to guidelines because people are not very disciplined. So this is where the cultural aspects come in. So in Singapore, when the government says, wear your mask at all time or stay in your house for 2 months unless you're going to buy food, we will stay at home for 2 months unless we're going to buy food, and we will wear our mask at all times. In some countries, you actually need legislature to make sure that you can punish people when they go rogue. And I think they did that not really for the punishment, but to give them legitimacy for all the steps that they took. They also created this COVID-19 Solidarity Fund to help the needy, and the EU injected some money into it. And they distributed food packs to the hungry, I think about 35,000 food packs to the hungry. And then to help the home learning, the online learning, they distributed tablets to schools to help people who didn't have that before. So again, a similar story to New Zealand. You had a government that was taking ownership and driving accountability very early on. So the reason I'm talking about this is it's important to get the context to see why we got it wrong in Africa. So let me start with the individuals, because as I said, for New Zealand, the fight against COVID-19 is not just a government problem, it's everyone's problem. So it's important to know what role you play and how you have contributed to the spread of this virus. So the first point is a complacent attitude. So like I said in the introduction, most people thought Africans would not get COVID-19. I have to admit, at some point, based on SARS, I was like, well, Black people didn't get SARS, so maybe this is not going to impact us as much, but it did. And when we saw that it was impacting us, people should have changed their attitude, but they didn't. And you still see people sitting around and saying, this is not going to happen to us, or it's a conspiracy theory and Bill Gates is the one who's spreading this virus because he wants to make money. The man has over $100 billion. Like, seriously, we need to change our attitude to this virus. Otherwise, we will not be able to fight it. The second thing is denial. Some people still don't believe that COVID-19 will kill you. And if you follow US politics, you see examples of senior people, politicians, or even young people who went to COVID-19 parties because they didn't think COVID-19 would impact them. And one guy died in, I think, Miami and told doctors before he died that he had made a horrible mistake, but it was too late and he died. Some people are defiant, and that's the whole thing. It's, but you decide not to do anything about it, or you turn to prayer and hope for the best. And then there's an element of ignorance, which is twofold. It's an element of the lack of public education to make sure people know, but it's also people not taking the time out to actually get more information about COVID. So instead of reading sensational stories about Bill Gates or WhatsApp messages, start looking for information that's actually useful. I cannot count the number of WhatsApp videos and messages I get on rubbish and not enough about actual facts and things that will save lives. So this is a call to action for people to actually do the right thing and educate yourself on how this virus is spreading and how you can protect yourself, your family, your friends, and your neighbors. And on the other side, it's the governments. I mean, most African governments are always underwhelming, and you can see that even today with the fight against COVID-19. Look at Tanzania. I'm sorry, I have absolutely nothing to say, a positive to say about Magufuli's government on this. See no evil, hear no evil, and burying your head in the sand is not a strategy to fight a global pandemic. And I'm still waiting to hear if former President Mkapa died from COVID-19. It would be interesting to hear if that was the case and if that would change the attitude of the government. But Tanzania's approach of pretending the virus doesn't exist and not testing people and not sharing data on how many people are sick is really worrying. And I wish there was something that the Africa Union or the East Africa community could do to actually change that. But that's probably the country that's the worst on the other side of the extreme. Most countries' challenge has been the lack of public health strategy to respond to pandemic. Now, to be fair, countries like Singapore were only ready for COVID-19 because they went through SARS and were hard hit by SARS. So they understood what to do the next time they had a coronavirus pandemic. And they prepared the infrastructure, they prepared policy, and they had a plan of action. African countries haven't had a pandemic of that scale, except the countries that were impacted by Ebola. So this is where I don't have a lot of sympathy for us not being prepared. My own country, Zambia, is right next to DRC, which has an outbreak of Ebola as we speak. And there is nothing stopping people with Ebola from crossing the border and spreading that into our country. Do we actually have a plan for that? I highly doubt it, because a public health strategy needs to be communicated to the people so that people know what they're expected to do. People here knew what they needed to do, and that's not coming across in Africa. West Africa, we had the pandemic back in a couple of years ago when I think Guinea, Sierra Leone, and one other country, I can't remember which country, I'm sorry, were impacted by this. You had a few cases in places like Nigeria. So what is our public health strategy to respond to a pandemic? And fine, we've never had a coronavirus. We've had one now. And I think it's up to citizens to check in a year or two whether we've actually put something in place to respond to this. The main thing that's a problem, and I flagged this earlier and I showed the stats, is inadequate testing. Countries have received a lot of money from donors to fight COVID-19. Where is that money going? It needs to be going into testing, and testing to get results to people quickly. So Singapore has a test that can come out with results that can come out in an hour, but I think the standard test is a few days. You're hearing cases in countries like Zambia where the results are not coming out for more than 2 weeks. In those 2 weeks, if the person is at home or up and about, they will spread that virus to other people. So what is happening with the testing? What is happening with the contact tracing? So how are governments actually contact tracing? And I gave the story of how Singapore does this. They will find you. There is nowhere to hide. In Zambia, how are people actually knowing where people go? And so those two things are actually what is causing our numbers to rise very quickly. And the last thing is the lack of a rainy day fund. So because we don't have high reserves, we constantly relying on borrowing and begging from others to fight our own battles. And I think this is something that we have to address once and for all. My own country, Zambia, uses foreign reserves to prop up the kwacha because the optics look bad. Foreign reserves to be used really in a crisis, and we don't have that discipline about how we use it. So I'm hoping that the virus, the pandemic, the response from developed countries that were able to dip into their savings will inspire us to actually change our approach to how we manage our reserves. And the last slide is just a call to action. It's just reminding everybody that everyone has a role to play to fight this pandemic. The first and most important thing is to stay at home. I stay at home as much as possible, and because the virus is starting to spread again, I've already told my friends I'm going to be very antisocial in August and September just to protect myself as the third wave seems to be hitting countries like Hong Kong, Japan, South Korea. The other thing is stay at home, but minimize contact with people outside your home. So I don't get a lot of visitors these days, and I'm quite ruthless about this. So you find I've had stories of friends and family in Zambia who are at home, but they're meeting people. It completely defeats the purpose. You're shaking hands, you're sitting with them without a mask. You don't know who they've been with and where they've been before they came to your house. So you're allowing the virus to come into your home. The third thing is wear a mask. I cannot stress this enough. And wear, ideally, a surgical mask. So in the beginning, they relaxed the rules about whether the mask needed to be a surgical one. But in reality, given that we know how deadly this virus is, I would urge you to actually get surgical masks. And if you want to make them fancy, I'll show you the mask that I have on right now. Fourth thing is wash your hands regularly. don't touch surfaces. So I've learned now that when I'm going down an escalator, I don't touch the handrail. When I'm opening the door, I open the door with my elbow, with my bum, or with my foot. I literally do not touch stuff anymore. I don't shake hands with people. I bow like the Japanese. I'm just making sure my hands are free from surfaces as much as possible because the virus lingers. So it lingers in metal for more than 12 hours. It stays in your clothes for 2 to 3 hours. So when I come home, I take everything off and I shower because the virus could still be on me. I put all my stuff in the sun because the sun actually helps to kill the virus. So little things like that just to keep you safe from contracting it and getting sick. And the last thing is building your immunity. And this is something my friends and I are all doing where we're taking vitamin C, we're doing zinc, and we're working out as much as possible so we can protect ourselves and fight this virus using our own body's defense system. So those are the few slides that I had on COVID-19. I'm going to go. Okay, so I'm going to go back to the show. Give me a sec. Okay. All right, so those are the few slides I had on the virus. It would be good to get your thoughts, so please let me know what you think about the analysis. If there's anything that you wanted me to expand on in terms of the countries, I'd be happy to do that. I will be turning this into a blog post, which I will post on ongolo.com, which is currently under maintenance and will be launched in the next 2 weeks, I think. With all my material on site. So you'll have articles, you have the videos, and you have podcasts. For people who can't watch YouTube videos, you can actually now listen to Ongolo conversations as if you're listening to music. So as always, thank you so much for your participation. I always appreciate your support. And please continue to check out the blog as soon as it's out and support ongolo.com. Have a great day.